A good and godly day to all of you who are watching us here on the program. This is Agenda, and I am your host, Cito Beltran. You are watching us via Cignal TV, channels 8 and 250 for high definition, as well as on Facebook.com/OneNewsPH. Today is June 10, 2021, and for the members of the Nationalist People's Coalition, it's 610, the birthday of their emeritus, Chairman Emeritus Danding Cojuangco. Okay, may he rest in peace. And it's a Thursday, and we will have a lot of guests for today. So let's get on with the program. And just in case you don't know about it, you can also watch us via YouTube. Just enter One News PH or by downloading the Cignal Play app. Let's get on with the day. Let's go to the front page of the Philippine Star. There you go. Government to NPA turn overdose behind landmine deaths. And COVID-19 cases down to 5,462, if I'm not mistaken. Philippine supply of vaccines to normalize by June 14. But the main headline, children not yet up for vaccination, says the Department of Health. Let's go to the bottom half. And there you go. President Duterte to Pacman or Senator Manny Pacquiao on West Philippine Sea, study foreign policy first. And Galvez endorses mayor's plea for more jobs outside NCR plus 8. Palawan under state of calamity due to COVID. Duterte retirement depends on Sara's move, etc., etc. Let's now go to the stories behind the headlines. National Task Force Chief Implementer Carlito Galvez Jr. says that the COVID-19 vaccine supply is expected to normalize by the 14th of June or by next week. Galvez says 11 million doses are arriving this month and that this will solve the supply shortages in local governments outside Metro Manila. Still on vaccines, Secretary Galvez has also endorsed the plea of the League of Cities of the Philippines to include other high-risk areas among priority recipients of COVID-19 vaccines. The LCP made the appeal as COVID surges continue to be recorded outside the National Capital Region plus 8, which consists of Metro Manila, Laguna, Rizal, Cavite, Bulacan, Pampanga, Batangas, Metro Cebu, and Metro Davao. And finally, Interior Secretary Eduardo Año is calling on the new People's Army to turn over those behind the landmine explosion in Anas Masbate, which led to the death of Far Eastern University athlete Keith Absalon and his cousin Nolven Absalon. Secretary Año made this demand after the CPP-NPA took full responsibility for the explosion or for the bombing incident. And today's quote comes from the book of Romans in the Bible, chapter 8, verse 31. What then shall we say in response to these things? If God is for us, who can be against us? And taking off from that quotation, I suppose some of the private schools, particularly the Catholic schools, are probably encouraging themselves with those kind of Bible verses because they are really in a quandary with what the BIR is trying to do. Private schools in the Philippines have asked the Court of Tax Appeals to stop the implementation of Revenue Regulation 5-2021. This aims to raise the tax imposed on private schools to 25% from the current 10%. To discuss this, we have in this part of the show none other than a regular ally of Agenda, Cagayan de Oro 2nd District Representative Rufus Rodriguez. Congressman Rodriguez, good morning to you, sir.
Mayong buntag. Good morning, Comrade Cito, and to all your viewers. Good morning.
How are you? May I ask, given all of the COVID outbreaks in your part of the Philippines?
Well, I am fine, and my family, and of course, Cagayan de Oro experiencing really big hikes in the percentage of COVID-19 positives. And that is why I'm glad that the Secretary Galvez of the Vaccine Committee is now recommending that the request of the League of Cities, including the request of our mayor, Mayor Moreno, and my two letters to the INTF and Secretary Galvez will be answered with the increased allocation of vaccines to our people in Cagayan de Oro and the other cities on top of the list of COVID-19 positive.
Okay, Congressman, before we go to the other topic of, the main topic of the education of private schools, let me just ask, does your city have any arrangement to directly buy the vaccines? Because that has confused a lot of people. Many people were under the impression that local government units, cities, were allowed to buy their own vaccines, and now we're in a situation where cities are asking for vaccines. What happened to that arrangement?
Well, some cities, especially in Metro Manila, have already allocated funds, and we have allowed them to directly purchase under the law to be able to even give more than the required, only the limit of 15% kasi in the procurement law, we've allowed them to pay even 50%. So that is for the cities. We don't know the status, but right now, the vaccines are all coming from the national government. So in the case of Cagayan de Oro, I'm not sure whether we have ordered vaccines directly, but certainly the vaccines are coming from the national government. And with this statement of Secretary Galvez, we expect in Cagayan de Oro, because we really have more than 75% increase for the past days. We have over 100 plus every day since May 15. We hope, Comrade Cito, that there will be more vaccines allocated to cities like Cagayan de Oro, which was reported by Octa Research to be in very high incidence or area of concern.
Okay, well, now going to our main topic, the Bureau of Internal Revenue Regulation 5-2021. There seems to be some confusion or misinterpretation of the spirit of the law. You're one of those who crafted this, if I am not mistaken. Could you explain who is in the right and who is in the wrong as far as BIR Revenue Regulation 5 2021 is concerned?
The law is very clear under the CREATE law, no, which was signed already by President Duterte. Now, the only persons confused is the BIR, the officials of BIR, because it's very clear under the law that it says proprietary educational institutions and hospitals which are non-profit will only have a 10% a tax for their income. Now, in fact, we had added a proviso because CREATE was really to also answer the pandemic, and of course, schools are hardly hit by this pandemic. So we also have a proviso, 10%, but from the period July 1, 2020, that was last year, up to June 30, 2023, the tax will only be 1%. That is very clear, Cito. Now, the problem with the Bureau of Internal Revenue is that they would like to use the phrase which are non-profit, which was descriptive of hospitals, to also include the first phrase, the first lines of a proprietary educational institution. That cannot be, because proprietary educational institutions are not non-profit. They are stock corporation, proprietary. And there will be gains from the operations of the schools because these are stock corporations. In fact, Comrade Cito, the Constitution distinguishes these two. That is why in the Constitution, under Article 14, Section 4, it is very clear that in the treatment of taxes, it says all the revenues and assets of non-profit, non-stock educational institutions shall be all exempt from taxes and duties. Okay, that is the first paragraph of Section 4, fourth paragraph. Now, the next paragraph after that, after describing educational institutions which are non-profit, non-stock, the second paragraph is proprietary educational institutions. And it says there in the Constitution, shall also be, can also be given the exemption from taxes and duties as provided by law, subject to limitation by law. So how can they say that only proprietary education institutions which are non-profit? That is a conflict of interpretation. Proprietary na nga eh. So it is certainly non-profit. That is why we have two kinds of schools dito in our constitution and in our laws. What are these? But you mentioned about the schools which are religious by religious orders like Ateneo, like LaSalle, like Xavier University, and also San Sebastian College. These are clearly non-profit, non-stock. So okay na yun. That's the first category. Exempt lahat yan under the Constitution. So therefore, the second paragraph, proprietary educational institution, means those which are stock corporations, which will have some gains. I don't know how the BIR would include, first, malayo itong which are non-profit, it describes hospital. Kasi nauna yung phrase under the law, great law. It says, proprietary, 37B, proprietary educational institution and hospitals which are non-profit. How can you put the which are non-profit as an adjective to the proprietary? It is a conflict of terms if you do that. So very clear. But because of what they did, I filed the Comrade Cito House Bill 9577. What is this? I made sure now, kinorek ko na yun so that wala talagang duda, although mali na nga interpretation, to make sure lang, ginawa ko na. So instead of educational, proprietary education institutions and hospitals which are non-profit, because they will consider the which are non-profit to also be descriptive of the proprietary, I made it now very clear. It says, the section will now read, under my amendment, House Bill 9576, it will say, hospitals which are non-profit and proprietary educational institution shall only be taxed 10%, and then 1% from June 2020 to June 2023. Just to make clear, because ang BIR is trying to make, in other words, some palusot dito. It cannot be a contrary interpretation. That is why I have filed this bill, and the POEA have gone to the CTA to enjoin them from implementing this. Otherwise, ito, according to the CHED report 2020-21, it is 900,000 less which were not enrolled from the numbers in 2019-2020 pre-pandemic. In other words, during this pandemic, 900,000 of our learners are not in public and private schools. How many have closed since March 15 or have suspended operations for this school year, 2020-2021? 865. That is the report. Now, ipapatungan pa ngayon ng BIR Regulation 5-2021, ang 10%, Comrade Cito, naging 25%, just like any other corporation in our country. Grabe talaga ang ginawa ng BIR. So that means that we should therefore appeal. I have appealed to the President himself, the Secretary of Finance, Dominguez, and the BIR Commissioner. Recall this as soon as possible. You are not helping our country. Education by the private sector is needed. Otherwise, kung wala ang private sector education, hindi rin kaya ng public school system natin, Comrade Cito.
Okay, so you're expecting all of this to be settled within the coming weeks. What would fix the situation? An executive order or the mere act of a withdrawal?
Well, Cito, there are two tracks. The first track is in Congress, 3 tracks. That is why Congress. So I'm very happy that Chair Joey Salceda of Ways and Means, because they will be the ones, the committee will be the ones that will determine my House bill, for example. And Chair Joey is also filing a clarificatory bill to clarify that proprietary really it should be only be 10% and then 1% from those period. So the first track is legislative. There will be a hearing, Comrade Cito, set by Chair Joey Salceda on Monday to be able to hear all sides. BIR, POEA, PAC, schools. And we have also the executive. We are appealing to the executive. There has been petition signed by the different private educational institutions, the associations, to the Secretary of Finance and to the President. That is the executive track, to ask for the rescission, the recall of this particular bill, this BIR resolution, and comply with the CREATE law that 1% lang from July 2020 up to June 2023. And the third one is judicial. Now, this will take some time. So therefore, the fastest is for the President to direct the BIR to recall this particular provision, this regulation.
Okay. Congressman, I recently heard the chair, I think he's the chairman of the Ibon Foundation, claiming that several 100 million or billion pesos have not been released. Money that were supposed to be released under those stimulus package laws that Congress, like the CREATE bill and the other stimulus package that Congress passed, na marami pa raw perang hindi nilalabas ang gobyerno at pinagtatakahan nila kung bakit hindi nilalabas. Do you know anything about this?
Yes, we have hearings on this. And when we heard Bayanihan 3, we were asking about Bayanihan 2. Yun ang nire-refer ng Ibon. It is not true. The BIA already said that 85% already of all the supposedly budget for Bayanihan 2 to recover as one have already been released. And before June 30, the DBM will be able to release the entire 100%. And then on the level of the agencies, this have been already more than 90% have already been obligated. It's not true. So it's really been, DBM is very fast on this, Secretary Abisado. And so therefore, it has been downloaded. Doon naman sa level ng agencies, departments, they are already mostly have already been obligated and released. So it's not true that there are so much
Mm.
many billions. It's not correct. So we are that is why you have to put in Bayanihan 3 because Bayanihan 2 will soon be completely be spent and given to our people and the stimulus to businessmen and other sectors, Comrade Cito.
Okay, now going to the next topic this morning, I just want to check on what your opinion or professional assessment is as a lawyer and as a lawmaker on what the president has said. President Duterte says it's possible to file murder charges versus fully aware COVID-19 positive individuals who still wander around infecting other people. The idea was floated originally by Secretary or Attorney Sal Panelo, and the president said reckless imprudence would still be the best complaint. You know, this reminds us of the early days of HIV, especially in America, where there were isolated cases of reckless individuals or individuals who were mentally affected by HIV to the point that they said, "Well, if I have it, I'm going to infect whoever wants to have sex with me, etc." Now, with the, what are your thoughts on that? Should we pass a law to make it criminal for individuals who knowingly go around infecting other people with COVID-19?
I would be against that, Comrade Cito. It will be difficult to put the elements of the crime of people going out deliberately to infect. First of all, I do not think that really people are out to infect other people. It's really a matter of implementation of social distancing to be able to make sure that there will be not much contact, and if people have the obligation to report if they feel the symptoms of that and they go to the hospital. But how will you put up the elements of the crime of deliberately going out to infect people? First, the intent will have to be there and you have to prove that in court. Now, how can you prove that? So to me, the best thing really, there will not be a law that will punish all of those that are doing this in deliberately to infect people. But there has to be a very strict implementation by the local government officials, by the national agencies, the police, in all of this situation, that when there is really a rule that there is social distancing, it should be followed. There should be no parties, no agreements, and there are already administrative sanctions for this. But we cannot make it criminal because the proposal of Secretary Panielo is to make this murder. So it should be life imprisonment. To me, that will be difficult to be able to put up a law on that, specifically on what will be the elements of the crime.
Because it would be ano yun, mass murder if you went to church to spread or you went to the palengke to spread COVID-19.
Yes. Yeah.
Oh, okay. Last issue, Congressman, may I just know your thoughts? Because yesterday I spoke with Undersecretary Jonathan Malaya. And by coincidence, we were, or was it the other day, we were comparing COVID-19 vaccination cards. And I realized, and I wrote about it for tomorrow's column in the Philippine Star, that not all COVID vaccination cards are created equal. Yung kay Yusek Malaya was
Mhm.
issued by the DOH. Mine is issued by Pasig City. I don't know if you already have yours, but I said, this is made out of carton or cardboard material, printed probably in some accessible printer. And I'm saying, what would they say about Filipinos traveling with this kind of cards? We had enough time to produce legitimate international standard cards. What are your thoughts on this?
Well, I believe that there should be a standard form for all these vaccination cards because precisely that card is now needed to show, because we are now going to the stage where travel will depend on vaccination in the airlines, in the vessels, and in even in land transportation. So we should have this, and we appeal that you are correct. There are different kinds of vaccination form. All the IATF should do, and Secretary Galvez, is that this form be made and be disseminated, social media, and disseminated by our press and social media, that this is the required form, and they can download this form so that it will be similar, because it will not be needed nationally when we go to travel, and even internationally. It should be something that should have dimensions, and it should have some, hindi lang pwedeng bond paper lang yan. Kailangan, yes, it is a more thicker kind of paper, and it should be uniform. That should be the case when the first dose is, when the second dose is. So therefore, it is very clear, and that is the issuing authority. So since the vaccines have been downloaded to local governments by the DOH, the local governments have been assisting the DOH in this, then the LGUs should be able, if the LGU can do it, but if the DOH can do it, this is very simple. They should do it already and be able to give it as soon as possible, a uniform vaccination card.
Well, I'm almost certain that you will be standing in the floor of Congress calling this out, because right now even the International Air Transport Authority, or IATA, is saying the first requirement is that governments must have the capacity to authenticate and verify the medical history or vaccination history of a traveler. In any case, Congressman, thank you very much for your time, and we do hope to continue our conversations here on Agenda. We appreciate your inputs. God bless you, sir.
Daghang salamat. Thank you very much, Comrade Cito, for the interview, and good morning. May buntag sa tanan. Thank you.
Okay, and doon po sa mga tiga Cagayan de Oro, please take care of yourselves. Please avoid unnecessary travel or going out and observe health protocols, because we are all in this, and hindi lang po kayo. You're not the only one suffering the challenge of COVID-19. Everyone is, and we just really need a little more patience and a lot of prayers. We'll go for a break. When we return, hopefully we can get Secretary Silvestre Bebot Bello regarding the concerns of Philippine nurses here on Agenda. Welcome back to the program agenda. You are watching us via Cignal TV, channels 8 and 250, as well as on Facebook.com/One News PH. I'm your host, Cito Beltran. And there is a saying, it's a hard job, but someone's got to do it. And that applies to our next guest, Secretary Silvestre Bebot Bello. Secretary Bello, welcome to the program, sir. On the line, there we go. Bebot Bello III of the Department of Labor. Sir, good morning. Okay, we seem to be having some technical difficulty there. We will keep trying and trying because there is an appeal. There we go. Sec Bello, good morning, sir.
Good morning. Good
Okay,
morning, Cito.
good morning, sir. Thank you very much. Sorry to disturb your morning on the go, but may mga apila kasi. There are appeals for the Department of Labor to reconsider or to postpone the deployment ban on healthcare workers, particularly nurses. What is your reaction to this, Secretary? Okay, we have a delay.
Oo.
Okay.
Meaning that we can deploy only maximum of 5,000 nurses and healthcare workers
Will you reconsider
to
that?
5,000 only in 1 year.
Okay.
We are seriously studying that. Kasi ang ginagawa namin Cito is uh, make sure na in the deployment, hindi tayo mawawalan ng nurses sa ating bansa.
Mhm.
Dahil importante naman na meron din tayong mga healthcare workers who will attend to the medical needs of our own people.
Okay. Now, Secretary, could you explain, pasensya na, hindi ko rin alam kung bakit, why does the United Kingdom have an exemption on that
Ano sito?
quota? Yung UK, meron pong exemption. They filed for exemption and they were granted an exemption. They were given more nurses. What is the basis of that exemption?
Kasi, yeah, yeah. Uh, well, unang-una, when the deployment cap was approved by the IATF, agad-agad nag-request ang UK that they be exempted. And at that time, we were still confident na hindi tayo makukulangin ng nurses. That is why they were given exemption. Then another country is also doing the same thing. Germany, they're also asking for the same exemption. But that is being also being studied by IATF, especially by the Department of Health, together with the Philippine Nurses Association, with the Philippine Professional Regulation Commission. Tinitignan namin talaga kung ilan talaga ang nurses natin sa Pilipinas. Para siguraduhin natin na kung pag nag-raise tayo ng cap from, let's say, from 5,000 to 10,000, matitiyak natin na hindi tayo mawawalan ng sapat ng number of nurses. And another thing, Sito, no?
Yes, sir.
Yung cap na yan, may exemption. The cap does not apply to yung mga balik manggagawa. Ito yung mga nurses and healthcare workers na nagbakasyon and pabalik na sila, hindi sila covered sa cap. And then yung mga may bagong kontrata na nakakuha ng OEC, they're also exempted from the cap. And then finally, meron tayong triple win agreement with Germany. Under this agreement, Sito, ang mga nurses can be deployed to Germany through a government-to-government arrangement. Walang agencies involved. So yung ang tatlong exemption. And anytime now, we continuously assess the situation as far as our medical healthcare workers are concerned. Ayun po. So it's not
Okay.
it's not far-fetched. It's not far-fetched ito na we may really seriously consider increasing the deployment cap.
Okay, that's good news, Secretary Bello. Now, related to nurses, this time for government nurses, they are appealing for help regarding what they perceive is a demotion by the DBM circular. Yung mga na-promote yung mga entry-level nurse 1 by 4 salary grades, pero yun namang mga nauna sa kanila, biglang na-demote naman daw, and then hindi pa rin nagkakabayaran. What is your reaction, Secretary?
Actually, itong issue na ito, Sito, covers only nurses and healthcare workers in the public sector.
Hmm.
Ang nangyari kasi diyan, yung bagong increase ng salary grade ng ating mga nurses ay tumaas. So, ang naging entry level nila is 32,000,
Hmm.
which is higher than yung mga dating naka-position na dyan na mas mababa ang salary grade nila.
Hmm.
Now, that is now being addressed by the Department of Budget and Management. And sooner or later, mariresolve yan dito. Kasi talaga namang may inequity na yung bagong pasok ay mas mataas doon sa mga dati na dyan. Oo, yun ang yan. So it's not a problem. I'm sure DBM can solve that.
Okay, now last question ko na lang, Secretary, and I don't want to spoil your morning, pero
No.
lumabas.
Dito, alam mo, actually, I'm inside a van and we are on board a ferry because we just came from Bantayan.
Oh, lucky you. Lucky. Nakakaingit ka. Ako garden
Hindi,
lang.
pero trabaho.
Ikaw dagat.
Trabaho ito.
Okay. Anyway, Secretary, matanong ko lang,
Yes.
no?
Apa.
Lumabas yung statistics that we had more unemployment for the month of April, I believe. Is this a really bad situation or is it normal because of COVID? Kasi syempre, we want to educate people to understand what's a bad figure and what is just, expected.
Actually, you are correct, Chito, no, na medyo mababa yung ating employment rate. Pero this is better now. I mean, this May and June is better now than yung nabanggit mo na February up to April. Dahil masyadong yung strict quarantine protocols. Because of that, humina ang operation ng mga businesses. And siyempre, the natural or logical effect is nababawasan ang employment. But then slowly we are opening up again because like for example lately they allow already the operation of hotels and restaurant up to 30 to 50%. Ganun din yung mga barbershop, yung mga spa. So with this development, umaasa tayo na aakyat muli ang ating employment rate.
Okay. Now, pagpasensya mo na, Secretary Bebot
Okay
Bello,
lang.
I'm just curious, what are you doing or what were you doing in Bantayan? You are in the Cebu area. Sabi mo, trabaho, so I can ask.
Trabaho. Actually, Cito, started yesterday paying out kasi we have a program which is called Emergency Employment Program. We hire the mga those affected by pandemic and we hire them from 10 to 15 days and after that we pay them. And we gave this program to
Whoops! Mukhang hindi sumabay sa barko yung signal ni Secretary Bello. But that's an interesting story there. It is an emergency employment program. And it's been done in past administrations Mabuti na lang it's being done in 2021 and not early 2022 because po when a similar program was done several administrations ago, it was called electioneering. But mukhang malayo naman sa eleksyon at talaga namang we have employment problems. Now, let's go straight to the city of Antipolo from Bantayan, Cebu ba yun? Let's go to Antipolo City. Let's speak to Mr. Relly Bernardo. I believe he is the head of the Antipolo Local Disaster Risk Reduction Management Office. Relly, are you there?
Hi, yes sir. Sir Cito, good morning po.
All right, good morning, Relly.
Yes.
Oh, thank you for your time, and I have been badgering and nagging Team Agenda to get someone from Antipolo kasi 2 linggo ko nang nadidinig yung mga daing, the appeals of people in Antipolo na parang unlike other LGUs in NCR, parang ang liit daw ng supply ng vaccine sa Antipolo or nakakalimutan ng Antipolo. Ano ba ang situation dyan sa Antipolo, Relly?
Well, good morning po ulit, no? Well, in terms of vaccination po, no? Dito po sa Antipolo, tama po yung sinabi nyo na kung ano lang po yung supply na binibigay po sa amin, yun lang po yung pinagkakasya po namin. Parang kung anak ka, bigyan ka ng allowance, pinagkakasya mo lang doon sa kung ano yung kaya mong gawin para doon. Pero kung titignan po natin yung bigger picture po ng aming pong lungsod, ang aming pong 2021 population projection is around 906,000. So sabihin na lang po natin yung tina-target po natin na 70% nasa mahigit 600,000 po yun. And as of the moment, ang nababakunahan pa lang po namin ay nasa 51% yung first dose, as yung second dose po is nasa 2.81 yung fully vaccinated po natin. So mukhang napakalaki po nung disparity. Kung i-compare po natin sir sa NCR talaga po na hindi naman sa parang naiingit sa kapatid, pero kasi sabi po ng national government, we are in a bubble, we belong to the NCR+. Pero pagdating po sa quarantine restrictions, kasama po kami. Pero pagdating po sa supply po ng bakuna, parang hindi po ganun po yung nangyayari. As we speak po, we have close to 100,000 po sa amin pong vaccine registration. So we have digital registration system po where our constituents can register. And malaki po pong porsyento po nung pong mga ito belonging pa rin po sa mga A2, A3 na hindi pa po namin nababakunahan. Nag-launch na po ang national ng A4 recently. So yung ating po mga kababayan naghahanap po sa amin ng A4 na, asa na yung bakuna? Kaya parang kami po, teka lang po kasi wala pa hong ibinababang bakuna ang ating pong national government. Meron pong dumating kahapon, 7,800 po na doses. Pero hindi po yun sapat kasi in a day, maximum, doon po sa mga identified po namin sa currently na meron nakaset up po kami, we can do as much as 9,000 per day.
So, dumadating pa lang yung bakuna, ubos na sa dami ng tatanggap. And in other places, they're talking about vaccine hesitancy, mga taong hindi bumabalik for the first dose. What is the situation in Antipolo?
Well, kung pagbabasihan po namin, sir, sa ngayon po yung bilang ng mga nagparehistro, we cannot say po na meron tayong vaccine hesitancy po sa amin kasi mataas po eh. Mas mataas po ang demand kung tutuusin sa supply. Yun po yung nagiging asa nakikita po namin problema. So hesitancy po siguro, mga ilan lang na siguro tinignan lang muna kung ano mangyayari doon sa iba, ganyan. Pero eventually, parang na-overcome na po nila yun. At eventually, may mga humahabol po. So,
Mhm.
sa ngayon po talaga, ang mas nakikita po natin sa ngayon talaga yung kakulangan ng supply ng bakuna na inamin na rin naman po ng national government. Siguro po, sa pangalawa, yung po siguro mixed messaging which confuses the public. Kasi po, they are saying nga po na pwede lang A4, pero in reality po, sa amin po, at well, sa case po ng non-NCR cities, particularly in our city po, talagang ano po, hindi pa po talaga enough yung supply para po doon sa mga sinasabi nilang
Okay.
priorities.
Really, based on what you've said and what other media outlets have said regarding Antipolo City, parang ang problema hindi hating kapatid. While Antipolo City is part of the NCR bubble, NCR plus 8 configuration, many people in Antipolo and independent media have pointed to the fact that parang in comparison, mas maliit yung rasyon or share of Antipolo in terms of vaccines. But has anyone in your organization done a mathematical comparison? Bagamat ako'y mahina sa Math 11, Take 7, kayo ba, pinag-aralan nyo? Kasi lumalabas naman sa mga talaan or in the reports of LGUs, how many have been delivered, how many have they vaccinated. Meron ba kayong comparison chart or data kung gaano kadehado ang kasi alam ko yung mahal na gobernador nyo dating si Ito Inares sabongero, hindi ko alam kung dehadista, no? Pero gaano kadehado ang Antipolo pagdating dito in terms of sa hatian ng bakuna?
Well, kasi sir, wala po kaming ideya doon sa ano sa bakunang tinatanggap po ng NCR cities. But siguro mga mailan-ilan kung ano yung na-announce po nila sa on TV, on media, yun po lang po nakikita namin. Pero yun nga, we can safely say po talaga na ang laki po nung difference po talaga. Kasi nga, sila po to think lang po sila po nasa A4 na, kami po, binubuno pa po namin yung A2 and A3 na
Okay.
naka-register po sa amin.
And hindi naman kayo patalon-talon, ano, Relly? I mean, in some cities, what they've done is, well, no one is present in the A2, let's go to the A3, or the A3 are few, let's go to the A1, etc. In Antipolo, you have been observing the schedule of vaccination, but the problem is, can you please confirm na while you observe the schedule of vaccination, you cannot advance because there are no vaccines and you are only on A2, yung mga senior citizen?
Yes, sir. Talaga po, as much as we can, sumusunod lang po talaga tayo sa tinatakda po ng ating pong national government. So kaya nga po, di ba, nilagay po yung A1, A2, A3 kasi meron po tayong prioritization. So, siyempre, as a parang good child or son or daughter po, sumusunod lang po kami doon sa gusto nila. So, sinabi nila, unahin mo muna A2 and A3. Yun po yung inuuna talaga natin. Kahit na anong pressure po, ang dami na pong mga nagme-message po sa amin, ang tagal na namin nag-register, A4 kami, mga lumalabas kami, nagtatrabaho kami, na-expose kami. As much as we want them to vaccinate all of them po, dahil na-recognize po namin, kinikilala po namin yung importansya po nila sa kanilang mga pamilya at sa ating pong ekonomiya, hindi po namin siyempre sir magawa dahil meron po tayong sinusunod na guidelines po from the national government.
Yeah, really, we were just showing a video na tinanggap na ng Antipolo City ni Dr. Lat ba yun? Yung second batch of vaccine from the DOH, yung Sinovac and AstraZeneca. Kailan ba yan? Baka naman lumang video na yan.
Sir, actually yes, nakita ko yung naka-flash. Parang March pa po yan.
Ay ko, sorry Akala ko breaking news eh.
Although dumating po talaga kahapon, pero ano lang, yun nga po, talagang hindi po sapat, sir. Sorry to say po.
how often are the deliveries of vaccines to Antipolo? Kasi I mean, in fairness, no, inamin naman ni Secretary Galvez, and he is one of the few government officials and IATF officials I really respect, because he has the humility to apologize. Nag-apologize na naman siya kahapon. Sabi niya, I apologize for the disruption, for the delay. Talagang may problema sa supply chain. Pero dyan sa Antipolo City, how often do you receive deliveries of vaccines? And on the average, how many doses do you get per delivery?
Sir, wala pong regular talaga na schedule.
Aha.
Opo. Although yan po, papasalamat din po kami na naging totoo po yung ating national government. Si Secretary Galvez po, same way we admire him po sa kanyang character. Pero nga po talagang sa reality po talaga, hindi po talaga ganoon ka-regular po yung pagbababa po sa amin ng bakuna. So, yun po. Siguro, kung wala pong bihira po yung nalampas ng 5 digits na doses. O sa po talaga, para pwede sabihin patingi-tingi kumpara sa natatanggap po ng
Patingi-tingi as in 1,000, 2,000?
mga 3 to 5 po minsan, mga ganun.
Per week or every 2 weeks?
Wala pong weekly, wala po talagang regular schedule na baba.
Okay, now, but how does this affect your management? Kasi doon sa iba, kaninang umaga na monitor ko sa iba-ibang radio programs kasi palipat-lipat ako, I've heard may mga taong pumupunta sa vaccination center madaling araw para makauna, kaya desperadong mabakunahan, and then only to find out, sorry, no vaccination today because we have no vaccines. Diyan ba sa Antipolo, are you experiencing parang frustration of vaccinees? Yung parang, ay nako, di bali na lang, wag na lang kasi pila kami ng pila, nakailang balik na kami dito. Is this happening in Antipolo?
Masasabi ko po sir na yan po yung sa pwede namin ipagmalaki po sir dito sa Antipolo City, na hindi po yan nangyayari tulad po nung sa ibang mga lugar na madaling araw may nakapila po, may mga naiinip, may mga nagbubu doon sa mga vaccination teams. Dito po naman sa Antipolo sir, po kami, naka-schedule po sila. Una sa lahat, naka-ready, sa malls po yung ating mga vaccination centers. Sa ngayon po, we have 5 malls na ginagamit. Para convenient po na yung mga tao at comfortable po sila. So, in terms of yung bilis po sir, marami pong natutuwa kasi hindi nila kailangang magpumila ng mahaba. Dahil nga po naka-schedule na po sila, the oras po. So, from we have 5 steps, from step 1 to step 4 yung actual na vaccination po. Hanggang mapicturean po sila sa photo booth. Mga 20 to 20 minutes lang po yan, 15 to 20 minutes, tapos na po sila. Mas matagal pa po yung paghihintay nila doon sa post-vaccination na mga 30 minutes to 1 hour.
Yung obserbahan.
Yes, sir.
Okay.
So, ang ganda po nung experience dito, marami po nagpo-post. Yun lang po bang maganda po doon sa aming pong pagbabakuna dito.
Okay, Relly, we'll just take a quick break. When we come back, balitaan ko lang kung ano yung situation sa Antipolo kasi alam mo naman ako, pusang gala. Marami rin ako mga kaibigan dyan sa Antipolo, bandang Rizal Street, sa may ilalim ng tulay. So, we'll get back to you. Let's just go for a quick break. Welcome back to the program Agenda, and kung nagtataka kayo bakit nakangisi o nakatawa ako, medyo na-realize ko lang, ito palang trabaho ko. No? For those of you who might be curious or interested to know, when you do this hosting job on work from home mode, I have a camera to look at, I have the monitor to look at, I have my cell phone to look at so that I can communicate with our executive producer, Gab Malyari, and I have to look at the iPad to look at the data provided by Team Agenda. So, plus, kailangan ko pa rin basahin yung private chat. So, medyo, kung ako po yung nadodokling, pagpasensyahan nyo na. Balikan natin si Relly Bernardo, and he is the head of the Antipolo Local Disaster Risk Reduction Management Office. Relly, welcome back.
Hi, sir. Hello po ulit.
Really, change of topic naman tayo because obviously wala kayong masyado nang magagawa dyan sa COVID na yan. Pero quickly, kamusta ba ang management ng COVID dyan sa health protocols and quarantine dyan sa Antipolo?
Sir, ano po, glad to say po, sir, na improving po yung ating COVID situation po dito sa Antipolo City. So, in terms of cases, nung magkaroon po ng surge, may namabot po ng 3 digits yung late active cases po namin. So, ngayon po, nasa 2 digits na lang po kami, and steady decline po yung na-experience po namin. Which we experience po doon din sa amin po mga sinasagawang tuloy-tuloy na testing, and at the same time po yung sa aming mga isolation facilities. So sa isolation facilities po namin, nag-close down na po kami nung ilang mga inactivate po namin nung magkaroon ng surge dahil talagang ano po, hindi na po naman napupuno. So para ma-divert din po namin yung resources sa iba pong mga activities ng city government. So that's what we did. In terms of treatment, yung occupancy rate po natin sa mga hospital beds, gumaganda na rin po, maluwag na rin po sa aming pong lungsod ng Antipolo. So, yung pong isang pinaka-reason po na ginagawa po namin, nagkaroon kami ng, in terms of contact tracing po, no? We have this pilot study with NEDA. Kasama po yung contact tracing consortium together with Pasig, Mandaluyong, Valenzuela. Nagkaroon po kami ng parang auto-contact tracing po kung tawagin, no? Kung nabasa niyo po yung sa IATF resolution na kung saan, since digitized po yung aming contact tracing, merong QR code po na may-scan sa pagpapasok ng establishments. Once a person parang has been detected na naging ano po siya or nag-positive po siya at tumasok po siya doon isang establishment, yung po kanyang mga possible pa lang po, close contacts would be automatically notified through through text na detect ng aming system na meron kayong na pumasok ka sa isang area na mayroong nagkaroon ng positibong kaso. So ina-advise ka na mag-isolate, i-monitor ng sarili, at kung mayroong mga mararamdaman, pwede po kayong makipag-ugnayan sa aming pong tanggapan. So that quick, sir, kasi ang isang talagang susi po natin, sir, sa mapigilan po yung pong ating pagkalat po, no, is yung fast isolation. So through auto contact tracing na itinutuloy po namin, yun po, ano po natin siya, napapabilis po natin yung mga parang hindi na makaikot yung mga would-be carriers ng virus.
Okay, well, thank you very much for all the information you're sharing, at sana naman madinig ni Tatay Digong yung daing ng mga tiga-Antipolo para yung mga anak niya hating kapatid sa bakuna at hindi maiwanan ang ating mga kapatid dyan po sa Antipolo. Thank you very much for your time, Relly, and please give our regards to Mayor Henares and her family from Agenda.
Thank you rin, sir. God bless po. Keep safe.
Okay, that's Relly Bernardo, head of the Antipolo Local Disaster Risk Reduction Management Office. And yun po, no, ang issue lang naman doon hindi naman sila nagdadabog, hindi sila nagtatampo or complaining. Parang they're just, expressing parang concern na parang impression lang nila ba hating kapatid ba to? Parang mas malaki yung hati ni kuya at saka ni ate kaysa sa amin. So I hope that Secretary Galvez and the IATF can address that concern because ika nga nila, we belong under one bubble or one kulambo. And what is given to one and to Neneng should also be given to Ito. Yung para po sa Antipolo. Okay, kamusta na lang kay Governor Ito Henares. And that's today's agenda. Please keep it here on Cignal TV channels 8 and 250. I'm your host, Cito Beltran. Have a good, godly, and blessed day ahead of you. Please take care.